I'm Dr. Michell Emett, and I'm going to tell you today a little bit more about dermal fillers and what can be done. So when we look at the patient's face, we really divide it into thirds. We look at the upper third, the middle third, and the lower third. And what you want is those thirds to all be in balance. So when we look at the upper third, just squeeze your eyes tight shut. And some patients have a little bit of crow's feet around there, and raise your eyebrows. And this area really we would use muscle relaxants in that area. Just give a big smile into the mirror with us. So there we can see where the cheeks were, and now relax for me. And you can see that there's a very small loss of volume in that area. What we would do is we would take quite a firm filler and we would place it onto the bone just to lift and contour the bone to give her back her cheeks. In this procedure, when you lift like that, you're also getting rid of the folding here, and you're also lifting in the jawline area. Coming down, we lift the nasolabial fold here. We can lift corners of mouth, and also you can see there's a little bit of loss of volume there. So we can smooth out the cheek and drop the chin by using the dermal filler. If you want to work on your lips, we try to be very, very subtle and natural with the lip, and we really give back the definition of the lip without changing the size or the shape of the lip. We're all born with a natural shape, and you want to keep that anatomy going. So if the patient has got lots of lines around the mouth, just by putting in the vermilion border, which is giving lip definition, we can separate the skin from the lip. The lipstick no longer runs into the skin, and you can get rid of most of those perioral lines. So what is filler? Filler is a natural gel which we get in our skins anyway. It's called hyaluronic acid. And just like our collagen gets lower as we're getting older, so does our hyaluronic acid. So we are basically putting back the hyaluronic acid. It's a clear gel, the same shape molecule, just manufactured in a laboratory. Because it's a natural product, we also have the enzyme to break it down. So any filler that we are using, 90% of those that we use that are hyaluronic acid are dissolvable and therefore are not considered permanent fillers. One of my favorite procedures to do is a procedure which we call skin boosting. So when we're playing with fillers, we're really looking at the way the light falls and the shading and the luminescence of the skin. We can use skin boosters to highlight different areas, and we can inject the skin booster in different ways. We can either go from one point in the skin and inject with a very fine tube, not a needle, a blunt fine tube, and we inject all the way around the crow's feet area and then down into the lower cheek area. This will also hydrate, plump, and tighten the skin by stimulating collagen. The other thing that we can do is to take the Vital injector, which is an injector with tiny needles, and actually inject the filler through the skin. So we can cover the whole face with the Vital injector. And obviously, never forget about the neck, the décolleté, and also the hand.